Saskatchewan is back to daily COVID-19 updates. This after a recent jump of 56 new COVID cases, the highest two-day increase in the province since early May. So, the question you might be asking yourself, is there a cause for worry? Is it time to make it mandatory to wear masks in public areas in this province? Well, joining us from Saskatoon is Dr. Anne Wong. She's a public health physician, and she's Saskatchewan's former Deputy Medical Health Officer. Anne, thanks for joining us.
You're welcome. Thanks for having me.
I want to ask you about this little spike in cases here in Saskatchewan recently. What do you read into that?
I think what we notice is that instead of cases concentrating in the major cities of Regina or Saskatoon, we've seen the latest increase occurring in central rural municipalities and Southwest. And what that suggests to me, based on what we knew of the recent outbreak in Southwest Saskatchewan, is that COVID-19 virus can spread quite easily given the condition. And as we reopen the economy, as people begin mixing more, it's expected that there will be increasing transmission and new cases unless precautions are taken.
You said we should be expecting increasing cases. Like, at what point would you become really worried?
Right. Now, one that the health officials were monitoring as an indicator of whether we've gotten COVID-19 outbreak under control is the number called called effective reproductive number, and that's the R number. And we've heard officials say we'd like to have it stay at 1. And that tells us that if one person is infected, they're only passing it on to another person at most. So the transmission is going to happen in community, but it does not increase exponentially and leads to a massive outbreak. So that would be the number that I would be requesting the health officials to provide us again as the numbers, as the raw case number goes up in the province.
You said right off the top that in the meantime, it's time to take more further precautions. And that, of course, brings up the whole mask debate issue here in the province. In Toronto, for example, it is now mandatory to wear a mask in a public indoor space. I believe the same in some other urban areas. What do you think of that?
I think this would be actually an effective tool that would reduce the risk of us getting a second wave and uncontrollable outbreak in Saskatchewan if there are support from the population, the business, to do so. That in huge part has to do with the newer data and evolving science that tells us now that when most of the people are wearing masks, even if they're homemade cloth masks, you're blocking the majority of the viruses that are spread through our respiratory droplets or tiny, tiny droplets called aerosols.
What would you advise then for example, what do you advise your family to do when you go out in public areas? What do you do?
So I am cognizant of going into indoor enclosed area, whether they are large or small space, because the research has shown now that the COVID-19 virus can in fact linger in the air for a few hours. So we can become infected through direct contact, or we could inhale the virus in. So I do try to remember to bring my mask and wear it when I go to grocery stores or any indoor space. What I advise and what I would advise my family to do is avoid crowded areas and wear a mask in public space, particularly indoor space. I wouldn't worry about outdoor space in general in Saskatchewan, because we do have quite a bit of a space in general. We don't get crowding too much in the outdoor setting, but certainly indoor setting where you're mixing with people outside of the usual household clusters, household bubble, that's quite important.
Now, given the numbers in Saskatchewan, you compare certainly to the U.S., but even in other jurisdictions in Canada, per capita, it's relatively low. When you look at some studies, one study I was looking at, and it said that they found that compliance, as far as wearing masks go, is really affected by the perception of risk. There are a lot of people that don't wear masks in Saskatchewan. What impact does the fact that there are so few cases have on people just not wanting to wear those masks?
I think it's very fair, but I also do think that the initial mixed messages from public health officials regarding the utility of face masks in preventing COVID-19 transmissions has led to the hesitancy and uncertainty around the benefit of using masks. It is important to remember that if we start mandating face mask use only after an outbreak has been detected, we're about 2 weeks behind on the curve already. And so in fact, if we can proactively take up the regular use of face masks in indoor public and crowded space, such as public transit, we actually have a chance of eliminating the second wave from happening in Saskatchewan. But that depends on us from preventing the transmission in the first place.
So if wearing the mask and being proactive this way can reduce the odds of a second wave that many people fear, so why wouldn't the province just go ahead and make it mandatory for everyone to wear a mask in certain public areas?
I think that's a question worth asking the health officials. Now, what we know is that the science has become more clear just in the past few weeks, even in terms of potential airborne transmission through tiny respiratory droplets that we call aerosols, as well as the effectiveness of masks. But also the data showing that surface contaminations don't come for as much of the transmission as respiratory droplets have just been published. So that tells us that cleaning down the surface, the doorknobs, isn't going to be as effective as source control, so preventing the virus from contaminating the airspace around an infectious person through the use of face masks. So I think both the evolving science, but also the initial stance from health officials perhaps is causing a bit of a hesitancy in coming around 180 degrees and now recommending that.
Well, speaking of being hesitant, the Saskatchewan Teachers, schools apparently is on in the fall, elementary, high schools for sure in Saskatchewan. And a lot of teachers who were surveyed by the Teachers Federation are very uneasy about going back into the classroom. They don't feel safe, they say. What's your advice for parents? Because I'm sure they're thinking long and hard about this, those who, of course, have school-aged children. What's your advice to them?
I think there are actually practical things that we can learn from countries that have kept schools opened and maintain low or zero case of transmission through the school. So one of the things that would be important, and I believe the school has been advised to do, is symptom screening. So that should continue. And that, I believe, includes a screening of fever and any respiratory symptoms. But we know that COVID-19 can be passed on from asymptomatic individuals. And so if we only look for symptoms, it won't be adequate. So it would be really helpful within the classroom, because these are indoor settings, that the teachers are wearing masks as they speak. And ideally, that the students are taught to wear masks when they are in the indoor classroom setting. Additionally, what we've seen is that during mealtime, these plastic dividers separating a youngster from another one could reduce the chance of that direct contact through respiratory droplets. So I think those three things are hopefully measures that are being implemented by schools.
How practical is it? You talk about the idea of all students wearing a mask, and I could picture a grade 3 class and all the kids playing with these masks. First of all, you're not supposed to be touching your face. There's also proper removal of mask protocols out there. How do you control that when you're trying to teach them how to read and write as well?
I would suggest that we create how to wear mask video and provide a little educational session for the students at the start of the school year. We've seen that students as young as age 5 or 6, such as my nephews who moved to Taiwan last year, are able to wear masks, and in Hong Kong, South Korea as well. So I'm pretty sure the students in Saskatchewan are just as smart and capable of learning how to wear masks appropriately if they're taught.
I would think so, but yet there's no culture of mask wearing, not just in Saskatchewan, but in North America. You talk about Taiwan, South Korea, for example, Hong Kong, and you look at studies. The studies show there's this culture of mask wearing there. It's much more accepting. So how do you change that culture? And really, there's a deadline here because there could be a second wave coming. So what do you do about that?
I have to say I'm not an expert on how to change people's behaviors. We do a lot of advising to promote healthier lifestyles in primary care, in family medicine. But I think professionals who study human behavior, and there's an emerging field called social marketing on how we can influence people's behavior for healthier lifestyles, perhaps could be consulted on how we implement and encourage the population to adopt a new habit.
So looking ahead, we've referenced this possible second wave, but what should people be doing and asking themselves here in Saskatchewan as they think about how they're personally going to be handling this pandemic?
Now, I think we've heard lots about waiting for the vaccine to become available. Now, that's assuming that we are going to have an effective vaccine. If the COVID-19 vaccine is similar to the effectiveness of our seasonal influenza vaccine, that means not everyone vaccinated will be protected, and not everyone vaccinated will not become infectious either. So despite this hope for the vaccine, I think the incremental behavioral changes and measures we're adopting right now are going to be important for us as we move forward in the fall, winter, as well as the next next 12 months. And what I would suggest would be that that for the public health officials to adopt a radical, transparent approach to how they handle the outbreak. I think a lot of public has been asking for more detailed location information of where the cases are. And in practicality, this is going to help us determine at an individual level whether certain activity has now become higher risk to participate versus 2 weeks ago when the case counts remain low. For example, in Southwest Saskatchewan. Just because things are reopened doesn't mean that the risk of transmission isn't there. But without that more granular details on where the new cases or transmissions are occurring, it makes it much harder for the average citizen to decide, is this something I still want to partake at this time or not?
There's certainly a lot of pressure to divulge, to be more detailed on information like that. But we do really appreciate your insight into this, and thank you very much for speaking with us today.
You're welcome. Thanks for having me.